So hi guys, our next topic for today is coronary artery disease. Now, just a quick disclaimer, I'm not a lecturer, I'm still a student, so study with me ang sistema natin dito. You guys can correct on the comments, but you cannot come to me personally. So, our topic for today is coronary artery disease. Now, this is only fundamental for us Filipino nurses to learn about is because this is one of the most common problems in the Filipino healthcare system. So, what is coronary artery disease ba? Sama na, uy, balik na lang dyan sa second year, pajud na ko na gans. So, coronary artery disease, the common problem here is that there is what? Students, guys, third year na lang ta, ma-fourth year na lang ta. Cause of coronary artery disease, the most common cause of CAD in short is plaque build-up or what we call atherosclerosis. Now, if there is plaque build-up in your coronary artery diseases, what will happen? What will happen? Of course, there is blood vessel narrowing. So ganun pala, sir. If na ay blood vessel, if na ay ka ng fatty build-ups or plaque build-ups sa itong blood vessels, there is narrowing pala in our blood vessels. Exactly! Ano pa ba? Hindi yan. So, of course, blood flow, if there is blood vessel narrowing, what will happen here? Guys, nasa board na hindi nyo pa gets. If there is blood vessel narrowing, there is decreased blood flow to your heart. Okay? So, oh my God, yellow ba? Iterik naman ta. Ano? Dolong rapod. Okay, continue. So, if there is blood vessel narrowing, there is decreased blood flow to the heart. Now, what are the symptoms, students, if you have learned med-surg throughout the years? Guys, of course, patient will experience chest pain, such as angina. Now, we will talk about angina, the different types of it on our next topic, ha? So, of course, it will feel like there is a squeezing pain. It almost feels like someone is standing on your chest. And it can sometimes also radiate to your what? Guys, jaw. And then at the back of the patient, mostly also at the left arm. So, those are the clinical symptoms of angina or chest pain. And then, of course, what? Shortness of breath, fatigue, and your patient will have palpitations. So, if this is not controlled, and in the long run, what could happen here? Guys, this can lead to MI, Miss International. It can lead to myocardial what? Infection. Myocardial infarction. What's the meaning of this? Heart attack. So, it could lead to possible heart attack. Now, next, who are the patients that are at risk for CAD? Now, let's talk about that one. Here, risk factors for CAD. Number one, of course, is what? High cholesterol. Patients with high cholesterol laboratory values. Why is that? What are the good cholesterol? HDL. Ano pa ba? LDL ba ipahay mo? Eh di wala. Patay yung patient kasi in the long run, magkaka-MI yan kasi ang taas ng plaque build-up because of LDL. So now, we want the HDL to be higher. Not higher, but in a controlled manner, si LDL and HDL. So HDL is our best friend here because what does that do? HDL has a protective mechanisms to your heart. Kaya, so if you have HDL that is in controlled state as well as LDL in controlled state, mas i-counteract niya si LDL na, huy, you're too much here in the blood vessels, get out because I need you to go to liver for the LDL to be excreted by liver. So in short, it has its own protective mechanisms for the heart, si HDL, and we want that one rather than LDL. So, next is smoking. Of course, smoking damages blood vessels in the long run. And we want that one to be controlled. If not, kaya stop na natin yung smoking, ha? So, we'll have to choose the lesser evil. If you cannot stop it, at least in a controlled manner until you're no longer dependent to smoking. Because it could lead to this one. Next, high BP. Of course, Chronic hypertension damages your blood vessels, di ba? Diabetes. Now, why does diabetes is included here? Diabetes has what we call AGE, advanced glycoprotein end products, that has a damaging properties to your blood vessels in the long run. And that's why diabetes is written here. Now, as what you guys can see here, most of this one has a damaging effects on your blood vessels, right? So it's only important that they are written here. So one is that high in cholesterol could cause plaque buildup. Next is this three, smoking, high BP, and diabetes. Now, next, move further. What are the medications? Student nurses, I bet you know this one already. Second year, fourth year, third year, pati bigay ng products na ito. Hindi niyo pa alam. Guys, of course, nitrates. We want the blood vessels to be dilated, to have a proper blood circulation in the coronary artery blood vessels. Right? Next, calcium channel blockers. This is also a vasodilation properties, and we want that one. Also, there are two types of this one, so it's important for us to know if it is meant for anti-hypertension or for arrhythmia. So take note and search for your own knowledge for those. Next is statin. What are the example of statins, everyone? Guys, atorvastatin. Atorvastatin. Ano pa? Rosuvastatin. Second year pa kayo bigay na. Hindi niyo alam na statins yan? Ha? And what is the best time to give statins? Of course, at night. Why? Because cholesterol production is mostly occurring or probably occurs a lot at night. So, it's only important to counteract those. Let's give statins for those so that there's no production of cholesterol. So, if that's the case, makontrol natin yung cholesterol, ha? So, that's why atorvastatin is mostly given at night to counteract cholesterol production. Next is beta blockers, of course. Common one, beta blockers are carvedilol. What are the patient education for this one? Of course, diet. Mediterranean diet. Guys, pescatarian, mga fish, mga fruits and vegetables, less red meat. So, ganun ha. Next is low calories, low sodium, low cholesterol. Sodium has always something to do talaga, no, with our blood vessels. So, control dapat yan. Low fat diet, and of course, increase your what? Dietary fiber. Again, HDL has these protective mechanisms in the heart that allows the LDL to get out of blood vessels and put it on the fat on the liver to get it excreted. See, so yun. Of course, healthy cholesterol. What is the values of cholesterol? Cholesterol should be at what? 140 to 199 mg per deciliter. Your LDL should be lower than 130 mg per deciliter. Now next, HDL, our good cholesterol that has protective mechanisms to the heart. It should be at 30 to 70 mg per deciliter. Okay? So ayun ha, yun yung discussions natin for coronary artery disease. Now, thank you so much for watching. I hope you enjoyed this one. Again, I could be stating some misleading information here. Please, you guys can correct on the comments so that you cannot come to me personally because I'm still a student and I'm still learning. So, study with me. Again, on our next episode, we will be tackling about angina and how can this lead to MI.